Welcome to Lessie Magazine presents Black Health, a weekly talk show discussing medical issues afflicting and impacting the Black community. Now introducing our host, Dr. Michelle Kirwan Blythewood.
Good afternoon. Thank you so much for joining us, and welcome to Black Health, a platform to discuss health issues affecting the Black community. I am your host, Dr. Michelle Kirwan Blythewood. I'm a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens. According to the CDC, every 40 seconds, someone in the United States has a stroke, and every 3.5 minutes, somebody dies from a stroke. With May being Stroke Awareness Month, we have vascular neurologist Dr. Jillian Gordon Perue with us to discuss vascular health, including strokes.
Thank you so much for having me. It is truly a pleasure to be here.
Welcome, and thank you for coming back on the show. And this is your second time, and we're pleased to have you back as a guest on Black Health. I'm going to take a moment to introduce you. Dr. Gordon Perue is an assistant professor of vascular neurology at the University of Miami Miller School of Medicine and serves as chief of neurology and director of the stroke program at Jackson South and Jackson West. Dr. Perue does research, has authored publications, and speaks nationally and internationally. Welcome once again, Dr. Gordon Perue.
Absolutely.
And before we dive in, we do want to remind you that we are here to answer any questions. Please feel free to submit your questions. So first question for you, Dr. Gordon, is what led you to medicine in general, and then what led you to vascular neurology?
Thank you for having me, and I really am excited to talk and share with your audience. So when I talked to my mom and my dad, they've said that I've always wanted to be a physician. They don't quite know where it came from. I'm a first generation physician, so it was kind of out of the blue and a little bit of a pie in the sky kind of dream. But, I had a wonderful support, and it's like all I've ever wanted to do. Vascular neurology in general came a little bit later. At first, I was really just excited about the neurosciences, understanding the brain, understanding the logic of it all. And it just clicked. It was like a puzzle. It made sense to me. But really what drew me in were my patients. I really was able to get connected to my patients, understand their problems, and then to help. With stroke, there is a lot of treatment that is available. And so there is a lot of hope. And I get to see my patients on that journey for recovery. And so that's why I chose vascular neurology.
Okay, very good. What is vascular neurology, and how does that differ from neurology, a general neurologist?
Yes, that's a great question. So general neurology will talk about everything that affects or is part of the nervous system. So that includes our brain, eyes, spinal cord, the nerves that connects these central parts to the body. Vascular neurology hones in a little bit further and focuses on the brain and the spinal cord and how the blood vessels interact with these major systems. And so to be a vascular neurologist, in addition to doing medical school, 4 years of neurology residency, we typically also do an additional year of fellowship training because it's such a super specialized field.
So when I think of vascular neurology, I think of stroke. What other vascular diseases or conditions do you treat?
So stroke, as you said, is the big one. And there are two types of stroke, and we'll get into that some more, the bleeding type and the clotting type. But in addition to that, the blood vessels can cause other problems in the brain. It can affect and be included in migraines. It can affect and be included in some types of dementia. But I am a general neurologist first, so I'll treat all neurological patients with a specialty interest in stroke and the cerebrovascular diseases, how the two things interact.
Okay, I didn't realize that. You do general neurology as well.
Yeah.
So what exactly is vascular disease? How would you define that?
So any condition that affects the blood vessels and then subsequently the part of the body that blood vessel supplies. So vascular medicine will include not just neurological conditions like stroke, but vascular conditions include the heart, the lack of blood supply to the blood vessels in the feet, as examples, because they're all very commonly affected by the same chronic medical illnesses like high blood pressure, diabetes, those kinds of things.
What is the most common cause of vascular disease?
So the most common cause, we group into two groups. Those that we can change, those are modifiable risk factors, and the others that we can't change, what we call non-modifiable risk factor. And by risk factor, I mean those things or conditions that increase your chances of having a vascular event or a stroke. Those things that are not modifiable, that we can't change, include age. I haven't found the fountain of youth yet.
Yeah, I'm still looking.
Right? So we can't change that one, right? So age, but then there's some things that we can change. And those are the things we want to encourage our patients or colleagues or family members to know and recognize and to change. And so this is things like having high blood pressure, having diabetes, having high cholesterol, not sleeping well, not exercising, not eating well. And the list goes on. There's one way to sort of remember this or identify this. American Heart Association is promoting something called Life's Essential 8. And if you just Google it, you'll find it. It will tell you about 8 lifestyle and behavioral things you can do to reduce your risk of having stroke and all the other vascular disease, since we share a very common start.
So what are some of the early signs of vascular disease? Are there any early warning signs that let you know that maybe there's let somebody know that something is going on or something is brewing?
So sometimes there are. Sometimes people will have headache because, the blood pressure is high. Sometimes you'll have a mini stroke, sort of a warning sign, sudden onset of difficulty talking or difficulty moving an arm or a leg or anything that you could normally do, you just suddenly cannot do, and then that resolves. But very often there are no warning signs and it is kind of silent. And so it really becomes important for us to check up on ourselves, right? To go that extra mile and have your blood pressure checked, because hypertension can be silent, or go that extra mile and get your blood test done, because diabetes can be silent until it's not. And the same for high cholesterol. And so I'll give you an example. My dad, for many, many years, was hypertensive, and he would say, "Oh, my head's not hurting me, so my blood pressure can't be high." And I would go over dutifully and check his blood pressure, and it's like through the roof. And he goes, "But I don't have any symptoms." And you would think that that's not a problem. But that's the point of awareness, right? To encourage us to say, don't wait until we feel something. That might be a little bit too late. Let's be proactive as best we can and get those numbers checked out, and then know your numbers and know what your goals should be and try to reach those goals.
Yeah. My husband and I were talking about a friend of his who hasn't been to the doctor in years and is just afraid to know his numbers. He's afraid of what he'll hear and afraid of what might be wrong. And I know there's a lot of people watching that are probably afraid that they have the setup for a stroke. But it's so important, because there's so much, I think, that can be done ahead of time that's preventive, that can stop the process of or developing a stroke or a heart attack, or many illnesses can be stopped if we just stop and get those numbers and address those numbers.
I agree with you 100%. 80% of strokes are preventable. Oh, wow. 80%. Wow. And that's a staggering number, right?
That is. That's very high.
That's a staggering number. And part of it is taking the time to take care of us. Like you say, sometimes people are scared about knowing what the numbers are. Other times it's life is busy. We've got kids, we've got parents to take care of, we've got children, grandchildren to take care of. And I don't feel ill, so why stop to check the numbers? And then 2, healthcare is really expensive. So how do I allocate resources in a tight budget and decide that prioritizing my health is important? And I think those are things we have to really grapple with. It's real life, it's reality. But I say to my patients, the the truth is, if we don't take care of ourselves now, we pay for it later, unfortunately. And so we really should take care of each other and say to that person, what is your number? Do you know what your blood pressure number is? Do you know what your cholesterol number is? Let's talk about it and start that conversation. And I think that's one of the things we can do with Stroke Awareness Month, knowing our own numbers and just telling one other person about knowing their own number. We would have done a world of good.
Yeah. That is great advice. And I think it's very encouraging to know that 80% of strokes are preventable. I think that can decrease some of the fear that people may have, about having high blood pressure or getting the diagnosis of high blood pressure or other diagnoses. So your primary area of focus is stroke as a vascular neurologist, I would assume. Can you tell us what exactly is a stroke? And what is the difference between a stroke and what people might hear as a TIA and may have some confusion?
Yeah, this is a great question. I hear a lot of confusing ideas about what a stroke is. People don't necessarily know what part of the body a stroke happens in. Sometimes we get it confused with a heat stroke, thinking you're just overheated and you're hot because you've been out in the sun. Some people think, oh, we're talking about lightning strokes, right? But really what we're talking about is sudden onset of a neurological problem because you've lost blood supply to the brain. So it's important for us to understand that the organ that's involved is our brain. And for some reason, the blood supply to that major organ, your brain, it's affected, and so it affects your ability to do normal things. Our brain controls our 5 senses. So if you can't see well, you can't hear well, you can't speak well, you can't touch and feel or move properly, that's an indication that a stroke may be happening. The way to remember this, because I just told you a lot of information, is be fast. So if you're having a stroke, I want you to be fast. So if you have sudden loss of balance, sudden eye symptoms, sudden face drooping, sudden arm weakness, sudden leg weakness, then it's time to call 911. And I really like that acronym because it not only informs you of how to recognize a stroke, but gives us the next steps of what to do when you do find those stroke symptoms. And that is calling 911 and presenting very early.
I think it's so important to know those signs of a stroke. Can you go through that one more time, the be fast?
Sure. And I can actually share with you a picture of it so that your audience can see it. So I say, if you're having a stroke, I want you to be fast. So B is for balance, E is for eyes, F is for face drooping, A is for arm weakness, S is for slurred speech, and the T is for time to call 911.
Okay, excellent. Thank you. So what are some of the risk factors for stroke?
So we talked a little bit about some of these. So before we talked a lot about the biological risk factors, hypertension, diabetes, high cholesterol. Sometimes there are genetic things that put you at risk that people don't know about. So if you have a family history of stroke, by all means, get that checked out and see if there's anything you can do to change that risk. And then there are a lot of behavioral things that we haven't yet talked about. So smoking, drinking too much alcohol, using street drugs or illicit substances, all of those things can actually increase your risk of stroke because they actually directly damage the blood vessel. And by damaging the blood vessel, it increases the risk of the blood vessel either getting blocked or broken and bleeding and causing a stroke.
What about stress? I think a lot of people want to know, because I think in this day and age, especially post-COVID, our political state right now in this country, every other day there seems to be a mass shooting. It's become so normal. We're numb to it. And I think our stress level has just slowly, it's creeping up and creeping up and creeping up. I'm seeing so much more road rage. Just what about stress? Because I know it's something that I think about. Like when I get stressed, I'm like, we got to bring it down 10 notches. You don't want to have a stroke. You don't want to have a heart attack. So speak to stress and maybe
Yeah.
allay some fears, or maybe get some people to de-stress.
Yeah. No, this is really a great topic. And I think as a medical community, we didn't quite understand how stress interplays with stroke. But now, especially since COVID, we're beginning to see how that is coming to light. Now we understand that there are actually different types of stress. Acute stress gets us motivated to act quickly, right? Think of it as your fight or flight system. So your blood pressure goes up, your heart rate goes up, and your body is using that acute response, that acute stress response, to get you out of a tough situation, right? Now, when that stress response is not just there acutely and comes back down, but is there chronically, it actually changes our biology. Yeah. And we're just beginning to understand that chronic surge of adrenaline is now leading to chronic high blood pressure and can lead to stress and stroke. It's leading to chronic damage to the blood vessels. And we think that it actually plays a role, this chronic toxic stress, because it can eventually become toxic stress, plays a role in some of the race disparities that we see. I don't think we completely understand it. We're just starting to delve into this. But a stroke in African Americans actually happens 10 years younger than our non-African American counterparts. 10 years younger. And we think that might have to do with stress. There's definitely a socioeconomic component to that. And you can imagine the socioeconomic stress that plays a role. But it's really, really complicated to sort of untangle what stress is doing. But definitely through this adrenaline rush, it can lead to chronic damage to the blood vessels. So take the time to de-stress, to compartmentalize, to take care of you, right? And find somebody to talk to. We were talking earlier, Dr. Kirwan, that this is Mental Health Awareness Month.
Yes.
Some of that, if it's not dealt with, can lead to chronic stress as well. And so trying to deal with these chronic things that we have in our lives is really important for helping us be healthier. A lot of us sort of bottle it up and move on, but really we need to deal with it just as much as we would deal with hypertension and diabetes and all the other biological things that we know about.
Yeah, I think it's so important how you spoke about the fight or flight and how that is short-term acute stress, and that is meant to be protective. Yeah. You know, back in the day, we're being chased by a T-Rex dinosaur, whatever you call it, and you have to take off running, right? But now to have that chronic stress, our bodies are not meant to live with those high levels of hormones of stress, and it really changes our genetic, destiny. We really, and this is something I've actually been very diligent about working on over the last maybe 6, 7, 8 months. I have really put in effort to decrease my stress. For this very reason, I really have come to understand how that chronic stress is so debilitating long term. Like it really will start to see those health problems come, and they will worsen and worsen if you don't get a hold of stress. So I think that's excellent advice to manage stress and manage it as early as possible and as well as possible. Going back to stroke, Dr. Gordon-Perue, what is the golden hour after a stroke? People talk about this golden hour.
Yeah, no, great question. And I'm glad you brought it up. So when a stroke happens, everybody thinks, oh, you've had a stroke, it's done, it's over with. But honestly, a stroke is a process. So when that blood vessel becomes blocked to the brain, or the blood vessel to the brain is broken, in that first hour, we can react and do things quickly to try to save brain cells and reduce the disability and reduce the bad outcome of having a stroke. So it's a process that happens more or less in that first hour, sometimes up to 24 hours, depending on which treatment we talk about. And so that really is an opportunity for us to intervene. And so this is why we say, don't just get in a car and drive. Call 911, because when you call 911, EMS is closely integrated with our hospitals. And so they will get our hospital team activated before you arrive. I'm part of my stroke response team in my hospitals. And so once the EMS tells me there is a stroke patient coming, we literally stop what we do and go to the meeting point to wait for you, because we want to maximize on that golden hour. We want to get treatment to you as quickly as we can to prevent disability and to save lives. And so it's really, really important that we talk about it. Thanks for bringing it up.
Important that we be fast, right?
Yes, yes, yes.
We be fast, yes. And we may have touched on this a little bit. We talked about smoking and lifestyle or whatever. Do you have any other information as to how to prevent a stroke? Your cholesterol down, keeping your blood pressure down, or anything else that we can do to prevent a stroke?
I think people underestimate how much exercise prevents a stroke. And so I think the take-home messages should be: eat right, exercise 30 minutes a day, 3 times a week, more or less, and then know your numbers and try to hit the goals for those numbers. So know what a normal blood pressure should be, less than 130/80. Try to make sure your number gets to that. Know what a normal blood sugar number should be. Try to make sure your numbers get to that. I think those are the things that you can actively do to reduce your risk of stroke. Knowing your family history, understanding your family history, what you're predisposed to, and then start working on those as well to try to reduce your risk. And then, of course, diet, right? And it's best when not just one person in the family is doing the right diet, but everybody is doing it together, right? So a low salt diet is so important. There's a lot of hidden salt in things that we don't notice. Canned goods, for example, a lot of the packaged things, well-preserved things, anything in a crinkly package probably has a lot of salt in it. So managing those hidden salts, managing your sugar, not to say you don't enjoy things, but try to find that common ground so that you're optimizing and preventing high blood pressure.
Yeah, balancing it. And
yeah.
My mom always says everything in moderation. So you can have some salt, you can have some sugar, but in moderation. And it just strikes me every time I do this Black Health show, it always comes down to these basics: eating right, getting your exercise in, managing your stress.
Yeah.
It all comes back to this, and it's
adding vegetable to your plate while you think about that, because
various colors,
a third of your plate.
Mm-hmm. You sound like the dietitian at my health center. But it's I can't think of the word, but it's depressing, I guess, for lack of a better word, that every time I do this show, it is the Black population, is the Black community that is mostly affected. And I feel like, one, we have to address how we eat as Black people, especially in this country, and stress, which is difficult. Systemic racism probably plays a large role in our stress. But I digress, but it just strikes me every time I do this show. So let's turn to some positive things. What are the possible treatments? You said that there are treatments. Is it medical? Is it interventional? What can be done?
Yeah, this is what keeps me very hopeful. The science is rapidly advancing, and there's a lot that we can do when you're having a stroke. So if you're having a stroke, please call 911 and come early. So first, as soon as you're seen, we will rapidly evaluate you and take you directly to CT scan. Typically, we want to figure out, is this a clotting stroke or a bleeding stroke? Because there's 2 different medications that we use. If this is a clotting stroke, we will consider a clot-busting medication for you. That's something that will actually break up the clot and restore the blood flow through that blood vessel that was injured. And in doing so, we can actually improve the weakness or the vision loss or the speech problem that you're having so that you can get back to normal, especially if we do it in that golden hour. We can only use that clot-busting medication in the first 3 to 4.5 hours of symptoms starting. So that's why it's really important to come early. Beyond that, there are things we can do up to 24 hours, which includes a surgery. And sometimes that surgery is to go in and actually remove the blockage that's there. And that has been a game changer for our field, because it really has saved the lives of the more severe stroke patients, where the clot is so long that the medication alone is not enough and you need surgery to take that out. And so all of that happens very rapidly, very quickly when you come in. If it's a clotting stroke, and we'll take care of that. If it's a bleeding stroke, there's actually medications we can give you to stop the bleeding. And these treatments can save your life and prevent disability. So please come early. And then beyond that first 24 hours, there are some complications of strokes that happen very often in the first 5 days. And some of those complications can put you at risk for pneumonia, for clots in the legs, and those can cause disability and further complications down the road. And so when you come in early, we can also address those, prevent those, and get you on the road to recovery faster with rehabilitation. So there's a lot to be done. And so I would say, don't hesitate. I would rather you come in and it's not a stroke and it's something else, than for us to miss the opportunity to save a life or to prevent disability.
What about stroke rehabilitation? Can you touch a little bit about that?
Yeah. So this is one of the things that is really, really very exciting in stroke. We've been working with our rehab teams and understanding when to start rehab, how much of it to do. And patients really do get better with rehab. The joy of working in my clinic is I see patients, go from wheelchair to cane to walking independently to, hey, I'm back to work. And a lot of that has to do with rehab. So usually we work hand in hand with the different rehab specialists. So first, our occupational therapist, speech therapist, physical therapist will work with you while you're in the hospital. And then once you are medically better, depending on how you're doing, you can go to one or other rehabilitation facilities to continue to get stronger. The good news is stroke recovery starts immediately after we remove the clot or stop the bleeding and can continue up to 2 years. It's fastest in the first 6 months. That's when it happens quickest, but it does continue. And so after a stroke, we say follow up with your neurologist, follow up with your rehab team so that we can try to get you stronger.
That's very encouraging that you still have a 2-year time frame to improve. That's different than many other illnesses. Yeah.
Illnesses. Yep.
What is the likelihood of a second stroke if you've had one?
Yeah. So about 750,000 people in the U.S. have a stroke, and the risk of having another stroke is about 20%. 1 in 5 people will have another stroke. So really, the minute you have a stroke or the minute you have a TIA, and I'll go back to that thought, it really sets off a team effort to try to understand why you're having a stroke, what's happening with your blood vessel, to try to prevent you from having another one. So it starts immediately at the time that we see you. A TIA, I think you had asked me before, we say a mini stroke. It's basically the same thing as a stroke. The T stands for transient, the I for ischemic, and the A for attack. So a TIA is a transient ischemic attack. Basically, it's a stroke that's happening, but it stops short and it doesn't actually leave a scar on the brain. So those symptoms are exactly the same as a stroke. The process is exactly the same as a stroke, except your body is able to break up the clot quickly so that it doesn't leave permanent injury. It doesn't leave a permanent scar on the brain. And whenever I find my patients with a TIA, I say, this is an opportunity. This is our wake-up call to understand what's causing you to have this and to prevent it as best we can.
Okay. What is the average lifespan after a stroke? And I imagine that probably varies quite a bit based on the type of stroke and the degree of the stroke. But is there an average lifespan, or is that been able to?
I mean, you answered your question, right? It depends on the type of stroke, the severity of stroke, and exactly what context it happens in, right? Mm-hmm. If you are having a second stroke in the context of having a previously had a stroke, the mortality rate is much higher, right? Patients with the bleeding type of stroke actually have a higher mortality rate in the first year. And so some patients have one stroke and live an active, healthy life after that. Others have a stroke and then it's, weeks to months, right? And I can't predict which it's going to be because it really depends on what's causing the stroke, right? And the severity of the stroke in the first place. So it's a little bit unpredictable. And I would say if you've had a stroke, talk to your neurologist to try to understand what are your risk factors, because again, strokes are preventable. So we can try to tweak that to give you a longer, healthier life.
Remind us again, or talk again about strokes in the Black community. I know you said that they occur about 10 years earlier than our white counterparts. Is mortality increased in the Black population?
Yeah. So strokes happen about 10 years earlier, and we are at highest risk for dying than other groups. And we are least likely to get the clot busting medication. When we look at this in the Florida Stroke Registry, which I work a part of, we looked at time to calling 911. And African American men and women took on average 40 minutes extra to call 911. Now, if you imagine that for each minute we do not restore blood supply to the brain, you lose 2 million neurons or lose a day, you can see how that 40 minutes has a very big impact. And so unfortunately, strokes happen earlier, about a decade earlier in the African American community, and we are at 2 times the risk of dying earlier from stroke than our Hispanic and non-Hispanic counterparts. And we're less likely to receive the acute treatments. There are things that we can do in the state to try to address these disparities, which is why I'm proud to work with the Florida Stroke Registry. We actually create a dashboard looking at treatment times by groups of patients, show it to the hospitals so that we can change things and tweak things. I'll give you an example. We found that patients who are Haitian were getting to the scanner a lot later than everybody else. And one of the things we were able to do is add an interpreter to the ER to try to reduce that disparity. So the hospitals do now get this information, and we are working with them to try to improve the reaction time and the system of care that we provide. But I think it's really important that a program like yours, Legacy Magazine, is doing this to raise awareness about stroke signs and symptoms so people present early. Because if we don't present early, when you get to us, even if we're doing everything as fast as we can, we're starting behind with regards to time. So the earlier you come, the better it is for your outcome.
One thought I had as you were speaking is that, I was thinking, okay, just as you said, it's great that Legacy Magazine is doing this and putting this information out there that people can say, hey, you know what, I'm having some signs and symptoms, the Be Fast, and I know I have a golden 1 hour to get this together, so maybe I'll go. But what struck me as you were speaking is some of the delay, I imagine, in our community is lack of health insurance. So I just want to say, you have to go. You really just have to go, because it can be a matter of life and death, or can be a matter of quality life and poor quality of life. Down the road. So, Dr. Gordon-Perue, what is UM doing to bring awareness? This is May is Stroke Awareness Month. What is UM doing in this month and perhaps in the rest of the year to bring awareness about stroke?
Yeah, we are very active, right? We want to get into our community, connect with our community. So I'm very thankful for this invitation to participate with Legacy Magazine. But we're also doing things on Twitter, University of Miami's webpage, on our Facebook page. We also have the Florida Stroke Registry website, where there's a lot of information, including the Be Fast protocol. We actually, through the Florida Stroke Registry, created videos about calling 911, why it's important to call 911. So you can watch it. It's quick. It's 2 minutes. You can share it with a friend that you think needs to know this. And then within our different hospitals, we're actually doing booths and awareness for our staff and for our community that we interact with. So EMS, for our nurses, and we're actually taking the message directly to the public, saying, know your numbers. So taking to them the Life Simple 8, having them check their blood pressure with us, and having that conversation about, what are your numbers? Do you really exercise 30 minutes a day, 3 times per week? How can we help you to stop smoking? Because these are the little things that we can do to change somebody's life and somebody's risk for stroke.
Dr. Gordon, this has been just wonderful, wonderful information. And I know that there's somebody watching that has a neurological issue that would love to come and see you. So how could somebody reach you if they wanted to come and see you in your office?
My absolute pleasure. So I can tell you my office number. So first, remember, I work with a team of neurologists. So reach out to us on our University of Miami webpage. You will find us there. I also see patients at Jackson South Medical Center. So you can also reach us there. I can tell you the number. Should I tell you the number on air?
Sure, please, yes.
So it is 305-256-4492. That's the office number. I'll say it again, 305-256-4492. I'm happy to take care of you, whether it's stroke or any other neurological questions. I have a lot of patients who come and say, hey, I think my memory is not so well. And then it turns out they've had silent strokes that they didn't know about. So really take the time, take care of you, take care of your family members, and get help if you need it.
Excellent. At the top of this show, I said that the CDC states that a stroke happens every 40 seconds. So in the last 37 minutes, we've had probably at least 37 strokes. So Dr. Gordon Perue, I'm hoping that you have prevented 1 or 2 of those maybe from worsening if somebody happened to be listening during this time. But thank you for all that you do, and University of Miami for all that they do in this area. I think it's just so important to get this information out. So we thank you. We really thank you for coming on. And you truly may have saved a life or improved the outcome of a stroke by being on here today with somebody learning and being able to spread this word. So continue to do the wonderful work that you do. And thank you again. I'm going to take a quick moment to say thank you to our sponsors. Black Health is brought to you by FAMU Medical Marijuana Education and Research Institute. Get credible information and engage in a safe space to learn and talk about cannabis. Educate, learn, and talk about cannabis in Florida. And don't forget about Legacy Magazine's other shows. On Mondays, we have The Business of Black Business at 1 p.m. with Jay Reynolds. Tuesday, we have My Money, Your Money at 7 p.m. with Bridget Lumpkins. Wednesday, we have Soul at 7 p.m. with Nikki Jellin. Thursdays, lunch with Legacy Leaders at 12 noon with Anne-Marie Sorrell. Taste of South Florida on Thursday at 7 p.m. with Chef Irie. And as always, Fridays, Black Health, hosted by me, Dr. Michelle Kirwan Bythewood, at 2 p.m. Thank you, everybody, for joining us. Dr. Gordon Perue, thank you so much. It has been a pleasure having you. Thank you for coming back, and I hope to see you again in the future on Black Health.
My absolute pleasure. I'll be happy to be here. Thank you.
Thank you. Have a great day, everybody. Bye.
Have a great day. Bye.